Hello, everyone. I want to welcome you to a new episode of the AM show. Today, I have Dr. Joel Gator Warsh, and I am so excited about this topic that he is going to shed light on. If you are suffering from any kind of ailment, then I strongly suggest that you listen to this episode and see if you can find a new source or reason or cause for your symptoms. This is the AM show with arts music lawyer, where ambition and motivation meet persistence and drive, where your wildest dreams come true and even the greatest possibilities become realities. Listen to people just like you who stay authentic to who they are and master the art of their craft. Are you sharing the art of you? The art of you is music to my ears. Stay focused, stay on track. Create a new lifestyle with ambition and motivation. The AM Show. This episode is sponsored by the law firm of Marcella Dominguez. If you're an entrepreneur, business owner, or artist looking to protect your brand, then Marcella is right for you. Marcella has worked with hundreds of entrepreneurs like authors, clothing brands, Amazon sellers, consultants, and entertainers. Protecting your brand does not have to be tough. Let Marcella save your brand before your business name or slogan gets pulled out from under you. Go to marcellatm.com to learn more. So welcome.
Thank you. Thank you so much for having me. I'm excited to talk about integrative medicine today.
Yes. So give everybody a little background. Where did you study and where are you now?
So I actually grew up in Toronto. And so I did my undergraduate training there. And then I moved to the States for medical school. And then I did my pediatrics training in Los Angeles. And so I'm living in Los Angeles now, and I have my own office. And going through residency and working in regular practice, I got a little bit frustrated with the regular medical system and the really short visits and treating everything with medications and not really thinking about root cause. And so that really spurred me into thinking about integrative medicine and learning about supplements and homeopathy and just other modalities that I could bring into my practice. And for me, especially when I was growing up, I was always having gut issues, but never really thought about it that much. I just thought it was normal. And after meeting my wife in residency and starting to eat her food and eat a little bit more healthy and organic, that all went away. And that was one of the things that really spurred me to look into it. And as well, when I was in training, there was this one patient who had a juvenile arthritis and was coming in and out of the hospital all the time, horrible pain. And I was on the team when he was there one time, and I saw all the food in the room. There's all this junk food. And I said to the team, maybe there's something to do with the diet. Maybe we should look into this. Why is this 10-year-old boy having all these symptoms? And I kind of got laughed at and kind of just moved on. And he ended up going home and then ended up coming back to the hospital a couple weeks later. Same thing again. I did a little bit more research, started talking about celiac disease and how, for some people with gluten, it can have all of these symptoms. Maybe there's something with the diet. And everybody kind of laughed it off again and thought it was silly. But grandma was actually there and said to me after, hey, that's pretty amazing that you're actually thinking about why this is happening. No one's ever really thought about that. Maybe I can talk to mom and we can come see you guys after, and then we can maybe work on things like you were talking about in the diet. And so they did. They came to see me outpatient after, and we changed up the diet. We worked on exercise. We talked about stress, a little bit more sleep. And that kid got better. Never went back to the hospital again. And he was going over and over and over again. And the 3 years I was taking care of him, never went back. And that spurred to me to say, hey, there's something else that I got to learn. I don't exactly know what healed this kid, but there's a little bit more to medicine than just treating with a pill. And so I need to go learn more. That's kind of where I got here.
You touched on so many things that I want to ask you so many questions about, but before we touch on all the good stuff, tell everybody what your background is. In other words, what degrees do you hold?
So I am a medical doctor, so I have an MD. I also have a Master's of Science in Epidemiology and Community Health. And then I have a certification in integrative medicine from the American Academy of Integrative Practitioners.
Perfect. Okay, so now let's get into the good stuff. You described a 10-year-old that was suffering from all of these terrible symptoms, right? Mm-hmm. I put myself in this kid's shoes as a 30-year-old, plus woman. If he was able to feel this way at only 10 years old, I can't even imagine what years and years of doing this habitually will do to a body by the mid-30s, by the mid-40s and 50s.
Mm-hmm.
So tell me, what has been the typical situation or case that you have seen for someone in their mid-20s or 30s suffering from something similar as a result of stress or any other reason?
Well, I think the most common thing that I see in the teens or younger adults would be that's new is really the autoimmune conditions. So just general body inflammation from whatever reason. So it may be from stress, as you mentioned, it may be from lack of sleep, maybe from poor diet. As a regular medicine at this time, we really don't know what's causing these things. We just treat them with steroids. And so I get a lot of patients that come in with these general, vague type of symptoms. So chronic fatigue, joint pains, rashes that just won't go away, that just things that don't have any cause. So the patient has been through all the regular medical system, done all the regular lab tests, maybe done some imaging, and everything comes back normal. The doctor says, well, I don't know, your lab work is normal, so I guess there's nothing going on. Or you have this inflammation, here's some steroids. I don't really know. And that's a very typical case that an integrative practitioner might see, where the patient's just been through the regular system, but just not gotten better. And so from an integrative perspective, that's where we may step in and say, okay, well, let's go back through your history. Let's think about things, and let's open up the vault a little bit. Let's open up the differential a little bit and think about some things that are outside the box. We don't want to miss any of the basic stuff, but if everything's been looked at, then let's try to think about those more uncommon things. So you have a picture of a zebra in the background. We call them zebras. Those less common things that might have caused a problem. So maybe there's some toxins in your environment, maybe there's some mold, maybe you're exposed to some sort of chemical or a metal, or you have high metal levels in your body. Maybe there's a food that's triggering some inflammation. Maybe you have some just general gut inflammation. Maybe there's a parasite or an infection that's just been going on for a while that nobody tested for or treated. So our regular medicine is great, but it only gets you so far. You can only do so many testings on everybody. And sometimes you got to be your own advocate and go outside the box. And maybe some of these tests are a little bit more expensive, so you're not going to do them on every patient. But if you're not getting better, then maybe broadening that scope can be helpful.
Okay, so let's put this into action. Let's say I go see Dr. Z. I tell him I'm not feeling good. I have these stomach problems. More than likely, he's going to say, here's an antacid. More than likely, he's going to say, okay, if I'm really pushing, okay, he might say, let's do this panel of labs. Now, what's the difference with someone like you? What is the first line of action?
The first line of action should be fairly similar for any practitioner. So the first line of action should be to get a good history. So to spend time with your patient and to go back and to try to think things through, because there are thousands and thousands of tests out there, and they can get expensive, and you can also have false positives. So you don't want to just send a ton of testing if you have the choice. You want to be more targeted and specific. So step one should always be spend time and talk with your patient. Now, in the regular system, sometimes that's difficult for a lot of physicians because you only have a very short amount of time to do that in the insurance model. So the insurance model works really well. If you're really sick, you usually can figure things out. You get sent to a specialist and they will figure that out. But if it's this more chronic underlying condition where you just have no idea what's going on, then oftentimes a regular general practitioner may not be the best option, especially if you've already talked to them. So you should go to them. I think you should still go see them. You should still make sure you're ruling out anything serious. But if they're not sure what's going on, then working with an integrative practitioner, and there are many different kinds, can be really helpful, because they may spend an hour or 2 hours with you, and then you can start delving into things you wouldn't really with a regular practitioner. So that might mean an integrative doctor or a naturopathic doctor or an Eastern medicine doctor or whatever it is that you believe in. But it's really finding someone that you can connect with so you can tell your story, and then work with them to try to figure out, okay, within this story, what makes sense for us to test? Was there some water damage at your house? Well, maybe we should look at mold. But you're never going to know that if you don't have that discussion.
Okay, I see. So I bet there are people listening who might say to themselves, you know what, I'm already a busy person. I have 3 kids. I am building my business, or I work for somebody else. They're really demanding hours. How am I going to set aside 2 to 3 hours for a consult to just talk about something that isn't based in science? In other words, you don't know much about my labs. maybe I'm skeptical because I feel like you're trying to make a determination based on a conversation, but not necessarily on results. What would you say to someone who's thinking those things?
And the first thing to say would be that it's not that you wouldn't be basing it on labs or results. It would just not be your starting point. So number one, if you had done all those labs, you should bring those in so the practitioner could look those through. And you still may order testing. In fact, in integrative medicine, you usually end up ordering more testing, but that's not an ideal place to start. If you go to anybody and they just order $1,000 worth of testing right off the bat, then that is not a practitioner that you should be going to. They're just kind of shotgun approach looking at things, and that's not ideal. You want to have a discussion so they can figure out what are the tests that you should be ordering, and you have to spend time to do that. And the bigger question which you're asking, which is a great question, is about stress and about time, and everybody's so busy these days, but that's one of the big problems in and of itself. And if you're not feeling good, then you have to put your health first. And so that may mean that, even if you don't want to, you got to find the time. You got to make the time, because if you don't make it now, then you're going to make it later when you're in the hospital. So it's really about, do you want to prevent it, or do you want to deal with it now, or do you want to wait till it catches up with you? And so it may not be, you may not have to be 2 hours. Not every visit is 2 hours, but it may be a 1 hour visit or a 1 hour and a half visit. And that's also usually just the first visit. Most times after that, it's not usually as long.
Mm-hmm. Okay. So what are the most common problems that you see amongst 20, 30-year-olds, millennials?
Number one issue right now is stress. So number one issue is just stress of school, stress of life, not enough time to do anything. And then I would say number two issue is gut health. So stomach aches, constipation, bloating, gas, everything that goes along with our poor diets, and just stomach pain in general.
So do those two actually go together? Is there a correlation between those two?
Definitely. So if we know that stress affects everything in your body, and it certainly affects your gut. We have a sympathetic system and a parasympathetic system, which basically the sympathetic is your fight or flight. So when a tiger is running after you, you can get away. And that's upregulated. That's what's going on when you're stressed. And when you're not stressed, then your body uses the parasympathetic, which is the rest and digest. So these things are at odds with each other. And if you're chronically stressed, then the blood is being shunted to other parts of your body, not to your stomach and your gut. And you're not digesting as well because you're dealing with everything else. So your body was never built for these chronic stresses. It was more built for back in the day when we were running away from animals, or we had serious things that could kill us. And so now we have these chronic stresses. So you're always having this low grade distribution of blood where it's not supposed to be, or stomach issues where it's not supposed to be happening because you're just not digesting properly.
Mm-hmm. Okay, so we know what could cause stress, any number of reasons, any number of things. But what other things could contribute to poor gut health besides stress?
Number one would be diet. So especially in America, our diet these days is horrible. We don't eat what we should be eating. And even if you are pretty healthy, there's only so many options that are available. So our food in general in America is just not great. So just from a general perspective, everything's got sugar. We got lots of preservatives, lots of food that we can make really quickly in the microwave. But really, food's not supposed to be like that. We're supposed to go to a tree and pick it off, or go hunt an animal and eat it, and not have something flown from across the country. And we also have, and for that to happen, then there has to be preservatives and chemicals and all of these things put into our food. So we have this chronic low-grade inflammation happening in our gut because we have all of these chemicals and pesticides and preservatives that are inflaming the lining of our gut, and it's a very fragile ecosystem. Mm-hmm. So that leads to gut inflammation, small inflammatory bowel disease in a very high portion of the population, and almost everybody has some sort of gut issues. We don't even notice it anymore because we're just so used to it.
So I think the obvious implication here is that we need to reduce our stress and eat better. But what does eating better mean? I mean, is an avocado that's good for you also good for me? Is a salad that's good for you also good for me?
It's a very good question. So nothing is right for everybody, and I think that's the key. You have to see what works for you and what makes you feel good, because you could be allergic to cucumbers, you could be sensitive to tomatoes, so it doesn't necessarily mean that everybody should have a salad. But what it does mean in a general sense is that you should prepare food as much as you can so that you know what goes into it. You should eat organic, non-GMO food as much as you possibly can, because you're just decreasing the pesticides and the chemicals that are going into your body. And does that mean that you have to do it for everything? No, it doesn't. But if you can do it to whatever degree, then that's going to be helpful. And there's a ton of research now where they'll take blood samples of people today, and then they'll put them on an organic diet for a week or 2 weeks, and they'll take those blood samples again. And the chemical levels go down drastically, even just in 1 week. And so it's not that your body can't handle these chemicals, it just can't handle them if things overflow. So your body's like a bucket of water, and water is pouring in, and it can handle most things. But if you have too much going on, then it's going to overflow. And so if you decrease the chemicals or the pesticides just a little bit, then that might help your body get back into balance and be able to deal with things a little better.
Okay. So how do I know what I should be eating specifically then? What if I go in there and I say, I want to know exactly what is right for me? I already know that I should be eating organic. I know that I should be eating more fruits and vegetables, but what else? Like, I want it to be specific to me. What tests are out there? What can you do to customize my treatment plan?
So you can do food allergy and sensitivity testing if that's something that you're worried about. Everybody is different. And so really, if you want to spend time on nutrition, that's a whole other field. And there's nutritionists as well that you can sit down for an hour or 2 hours and come up with a specific plan just for yourself. So that is something to consider, but not everybody necessarily needs that. A lot of people can just eat based on what makes them feel good and eating just general healthy food. So vegetables and fruit, basic stuff. We all know this, but that's something that you want to make sure that's a big portion of your diet. And then good healthy proteins. So good fats, good meats. So not that we can't eat any of this stuff, but a good salmon, good organic chicken. You want to have those as well mixed in with your diet. And then if you're worried about sensitivity, you can also do the food allergy panels or the food sensitivity panels, see what you are sensitive or allergic to, and try to cut some of those things out that you may be sensitive to.
So I follow Naveen Jain. Are you familiar with Naveen Jain?
I know the name. I don't follow, but I know the name.
Okay. So he has actually come up with this test kit, and it's called Viome. And he says that basically everything starts in the gut. And so this test is meant to analyze a bunch of different things like the bacteria in your gut, and also specifically the foods that you should eat, because I posed the example of the avocado, but that's something that he actually says, it's just because it's good for me, it doesn't mean that it's good for you. And so I was wondering, what does the latest research say in general about, testing the bacteria in your gut, or how certain foods that we might eat affect the bacteria in your gut?
So it's a good question, and the research still very much lags behind in the general medical community with a lot of this testing. When you're talking about stool testing, just the general stool testing, if you go to Quest or LabCorp and do looking for bacteria, fungus, and things like that, that stuff has pretty good efficacy and has a lot of data behind it, but you're just looking at things under a microscope, so you may not see everything. Then you have the more advanced functional tests where they might look at things in DNA PCR, and they might look at things at a smaller level. And again, most of that does have pretty good validity and research behind it, that if they do find it, that it may be there. The bigger question is, just because they find it doesn't mean it's causing a problem. That's where we're not quite there yet. So it really comes down to if you find things and how much symptoms are you having. If you're having a lot of symptoms and it makes sense, you could treat it. So for example, Klebsiella is a common thing that is found on these stool tests, but it's not always pathogenic. So just because you have it, a lot of bacteria can be normal in your body. So with our gut and our microbiome, there's billions and billions and trillions of bacteria and fungus and everything else there. So it's not just because there's a bacteria in your gut that it's a problem. So that's where we're really lagging behind right now in terms of the research, because a lot of this stuff is outside of regular medicine. So nobody is necessarily testing other than the companies, which is a little bit biased in terms of their research. So I don't have a problem with the testing. I think you just need to go in understanding the limitations of it, which that when you do testing, you might find things that are not necessarily there. But at the same time, if you don't test at all, you can't find it. So if you have a major issue, to me, these things are worthwhile to do. If you're pretty healthy, then it's not necessary to do all this advanced testing, because you might find things that are not necessarily causing a problem.
I see. So on a very basic level, someone who just wants to stay healthy and be healthy, what supplements should they consider maybe?
Each person is different, but in general, I think some of the number one things to be on would be a multivitamin is always good, just to make sure that you have enough of all of the minerals and vitamins. Vitamin D, everyone seems to be vitamin D deficient these days. No matter who you test, every time it comes back, it's always in the 20s or 30s, and we're looking for 50 to 80. And that's just because we're not getting enough sunlight. Even in LA, everyone's inside, they're on their computer, they're driving in their cars, and our bodies were built, the way they were thousands and thousands of years ago when everybody was walking around outside. And we're worried about skin cancer and things like that, which are warranted, but we also, when we're outside, we're putting on layers, we're putting on sunscreen, so we're not getting the vitamin D that we need. So that's a fairly common thing that people will do. Vitamin C can be really helpful, especially for infections. Elderberry syrup is great for immunity as well. And then some of the like astragalus, maitake, shiitake mushrooms, those are also very good in terms of supplements. So I like the general stuff, and then maybe like an immune support or immune booster if you want. But for healthy people, don't necessarily take anything if you're healthy. I think these things are all supplements, so I think it's good to rotate and have different things in, but mostly get it from your diet.
Good. And do you have a preference for brands? Are all brands created equally? Uh-oh. Can you hear me?
Yeah, that's a really good question. So definitely not. All brands are definitely not created equally.
Okay.
I can hear. Can you hear me?
Yeah,
okay.
There was a lag there.
Okay, got it. Awesome. So many brands are not created as the same as some of the practitioner brands. So you can go to Whole Foods or go to Amazon, and there are a ton of options. But what I think most people don't know is many of those brands, they all come from China. They all come from huge vats for supplements. Let's say you have a vitamin C. They're going to have this huge vat of what they call vitamin C in there, and they're going to do one little test. They're going to go into the top and take out a little bit. But what happens is they know this, so then 90% of it is not exactly what they say. So when you actually get the supplements that get sent out, what's actually stated to be on the bottle isn't the case. And that has become a huge problem in the supplement world. And when all the independent people do this testing, it's mind-blowing how many times they won't find anything that says on the label, or they'll find nowhere near the percentage that they're stating. So for me, when I'm recommending things, when I'm choosing brands for my patient, I like the ones that they do a lot more testing themselves. So there are several companies out there that will put on their bottle a SKU number, and you can put that SKU number to the computer, and that will show you the testing for that specific bottle. So a good example is Nordic fish oils. So they have that little SKU number, so you can actually go in and see the mercury testing and lead testing and all of the testing they do on that specific bottle instead of all of their products. And so at least to me, that's one more level of protection to say there's a better chance that what's actually in the bottle is actually in the bottle. Nothing is perfect. Anybody can lie, and anybody can have certain parts of their products that are not exactly what they say. But to me, at least, I'd rather the one that does the more testing and goes to that effort to do it. So they're a good brand. Metagenics is another excellent brand. Thorne is also a wonderful brand. A lot of the Olympic athletes use Thorne for their supplements because there's a specialized testing that you need for Olympic athletes to get those products, because it has to, for sure, what's on the bottle has to be in there, because otherwise they'll get into trouble. So you get that extra level of quality for some of their products. So there's a lot of companies like that, and so that's what I tend to recommend.
Nice. So for people that are just, they feel like they do have chronic fatigue, or they feel like they have stomach issues, where should they start?
The first place to start would be talking to your own regular practitioner, someone that you know and trust. If they're excellent and you love them and they can handle these issues, then that's where you would want to go, because it's important to have that relationship. If you feel like you've been through the regular medical system and it's really just not getting you to where you need to be, then the next step would be to ask other people around you if they've been to practitioners. Functional medicine is a huge branch of integrative medicine. And so you could go onto the Institute of Functional Medicine and find practitioners in your area, or you could look for naturopaths or integrative medicine doctors or Eastern medicine practitioners. So it just depends on what you believe in and what you'd want to do.
Mm-hmm.
But there are so many integrative practitioners out there now, and they're everywhere. So you can find them in your own area. And that's the easiest place to start. So just looking for those practitioners, just Google it.
Okay. Any other tips for just, taking it easy and because it seems a little bit impractical when people say, keep your stress levels down. I mean, the reality of life is just that we have so much going on. So what is your advice for keeping stress levels to a minimum?
So for me, my general advice always is to focus on the things that you have some control over. So those foundational factors, the diet, stress, sleep, and exercise. And it's very easy to say, okay, just decrease your stress. But the question is how? And for each person, that's different. And so you need to sit down and think, well, what makes me the least stressed? Is it gardening? Is it going dancing? Is it going out at night and doing whatever it is, being out with your friends, finding those things and making sure you start putting those into your schedule, because we're all so stressed at this point. We're all so busy and we're not focusing on what that's causing to us in the long run. And so we need to step back, and that's where, meditation, mindfulness comes in. It doesn't have to be a big kumbaya thing. It just means getting outside of a regular day schedule, being present in the moment and doing things that get us away from our stress so we don't have to think about it. So
Mm-hmm.
you don't have to go to yoga class, but you could. But you need to think about what it is that you do that keeps you not so stressed. And that's where that mindfulness is. So thinking about it. So when you're getting really stressed, pulling yourself back and making that a priority. If you make it a priority, you can do it. And it doesn't have to be 2 hours or 3 hours. It can be for 5 minutes a day, but that makes a huge difference.
Mm-hmm. And so I know that you might have stressful days too. So is there any music in particular that you like that just really pumps you up or gets you out of that stressful zone?
For me, the music that gets me out of the stress is usually jazz music or just Ayurvedic or Indian or Eastern music. So this the kind of music that you would hear when you go into a wellness center. I don't know if I had to describe it, but just that like very calm, peaceful music, maybe with different instruments from around the world. I think that's really nice and calming music. And there's also lots of great meditation music out there that's good for sleep. And you can just YouTube it or Google it and just find that, or like running water with a little music in the background. And that always, if I'm just a little bit overstressed, I can always put that on, and it just calms me down. It doesn't make me feel 100% better, but it just reminds me to take a second to take a breath.
Okay. And what's the latest book you read, or what book do you recommend to others?
So one of the books that I love for me that I read recently was the Integrative Pediatrician. So I'm a pediatrician. I work with kids, and so to me the book was by Dr. Kathy Kemper, and it's a great book about different modalities and integrative pediatrics and how to treat those. So if you're looking for something for your kids, it's a really good one.
Mm-hmm. Okay. So I just have 2 more questions before we close out the podcast.
Yeah.
One, eczema and peanut allergies seem to be the 2 most common issues right now amongst kids.
Mm-hmm.
So, I mean, for kids with eczema, they say apply this steroid topical cream, or there's Aveeno, or what is your biggest recommendation for eczema?
So it depends how bad the eczema is. I see a ton of eczema, and I agree with you. It's skyrocketing right now. We still don't even know why so many people have it. We know that it's excess moisture leaving the skin, but the question is why. A lot of times it's food and diet related. I found the vast majority of the time, if you can figure out what food is the trigger, and it's usually dairy, if you take that out, most of the time the symptoms get significantly better. But you need a plan as well with just taking out the diet. So there's nothing necessarily wrong with using hydrocortisone, steroid creams. We still use it. I just caution parents that it's a medication and you want to use it when you really need it. And we know that for eczema, it's a cycle. So if you start scratching and you get itchy, then it gets inflamed and it gets worse and worse. So when things are getting worse, that's a good time for a day or 2 to use the medication to get it under control. But there's also lots of natural things you could be doing before and after. So you want to use that medication to get yourself back into balance so the natural stuff could work.
So
So
what?
I like, so most kids are vitamin D deficient, so that tends to be very helpful. Fish oil tends to be really helpful for decreasing inflammation and for skin health. And I like calendula cream as well. So we have a calendula cream made by one of our herbalists for our patients. So we use that along with hydrocortisone, or just, most people have their general creams and lotions at home. So Aveeno or Eucerin or shea butter or coconut oil, whatever you have that you like at home. Some are more natural, some are not as natural, but you just try different ones and you see what works, and just be moisturizing all of the time until you get it under control. And if you do that along with the diet changes and get the diet changes correct, then usually I will see within 3 to 6 months a significant improvement.
Great. And what about the peanut allergy? Just stay away from peanuts, or what supplements might help with that?
I don't know. That's a good question. When we were growing up, I don't remember a lot of peanut allergies. It's so common now. It's crazy. One of the theories is that we really weren't doing or touching peanuts for too long, so we weren't gaining the antibodies to it properly. And so now everyone's giving peanuts earlier, but it still seems like peanut allergies are everywhere. So I don't know. I mean, that's a tough question. It's hard because peanut allergies can be so dangerous and deadly. So you don't want to mess around with that. But at the same time, it's all inflammation, and it all goes back to that. And if you can get the rest of your body's inflammation under control and heal your gut, then hopefully you won't react as significantly or even at all to an allergen. And just like any other allergen, peanut or wheat or whatever it is, if you heal your gut, if you give it time to heal from whatever was damaging it, then oftentimes you'll see those symptoms get better or go away. And I have seen people with allergies get better. So it is possible. It's not always that easy. And certainly if you have an anaphylaxis to peanuts, it's not something you're necessarily going to try.
Right.
But you still can try to heal your gut just for your general health.
Okay. All right. So to close off the podcast on a very high note, I want you to give us your best case study of someone that came in suffering from whatever issue that is pretty much maybe not 100% recovered, or if they are, that's great.
So one of my favorite stories was I think they were 3 months old baby. And this baby was the first time I was seeing them. They had severe reflux. So they were spitting up all the time, and they had been to 2 other doctors and 3 gastrointestinal specialists, and they were getting ready to do a scope because the reflux was so bad. And so they were going to put a tube down the kid's throat a week or 2 later. And I had met the family, and we went through their history, and we started talking, and I was asking them about when did this all start? And they said, oh, it all started about a month and a half ago. And I said, okay, well, did anything happen around then? Any changes in the diet? And they were like, oh yeah, right around then, we actually stopped breastfeeding. We started doing formula. And I said, oh, okay, which formula? And they said, Enfamil, I think it was, or one of the regular ones. And I said, did anybody talk about that there could be a milk allergy or anything like that? There could be an allergy from the, and they said, no one ever really mentioned that. No one really ever asked about that. I was like, oh, okay, well, maybe we should, before you guys go get a scope, we should try to change up the formula, use one of the formulas that doesn't have dairy in it, or low dairy content, broken up proteins, and let's see if it gets better. And we changed it, and within a couple of days, the kid was doing much better. They were still having some reflux, but it was significantly improved. So they held off doing the scope, and within a month, the kid's reflux was completely gone, and it just turned out to be a dairy allergy. And it's not always that simple, but sometimes it is. And if you don't think about the root cause, if you just keep treating, and they were on 3 medications that time. They were doing 1 medication, it wasn't working, so they went on to the 2nd medication, and then we were able to pretty quickly start coming down off those medicines. And instead of thinking about why, everybody was just thinking about, well, it's happening, so let's try to treat it. And we're not treating it, so let's treat it with a different medicine. But if you don't ever get to the reason what's happening, the medicine won't do anything. And so that was a really great, wonderful story where I was just excited for this 3-4 month old baby that didn't have to go get a tube down their throat, right, because no one ever thought to just switch up the formula. And that's not saying that a regular doctor wouldn't. Most of the time they would think of it, but just nobody had thought of it in this case for whatever reason. And saving a baby from getting a procedure and going under sedation. It was great.
Yes, that is awesome. All right. Well, I want to thank you so much for sharing all this valuable information. I hope that listeners are inspired to maybe look at different root causes for their problems. And so tell people where they can find you. Maybe if they're in the LA area, they might want to make a consult.
Sure. So you can find me at Integrative Pediatrics and Medicine.com. And I'm also starting now, we're just taking over and revamping integrativepediatrics.com. So on there, we're going to have some courses and lots of materials and lots of directory of where you can find different integrative practitioners and pediatrics all over the world. So we're just revamping that right now. But for the moment, especially if you're in the area, then integrativepediatrics.com is the best place to find me.
Awesome. All right. Well, thank you so much.
Thank you. Have a good rest of the day.
You too.